Hemorrhoids, also called as piles. Hemorrhoids are enlarged veins which are present in the lower part of our bowel, also called as anal canal. They are all present in every individual. When they get enlarged and start causing symptoms, we call them pathological or problematic. Hemorrhoids normally help us in giving that cushioning into the anal canal. They cause tightness in the back passage to prevent leakage. But when they do get troublesome or problematic, they can cause prominent lumps, leakage, itching, and bleeding. Bleeding from hemorrhoids tend to be bright red, and majority of the times it is a painless bleeding that patients describe. The bleeding is seen when people either wipe or it can be dripping into the pan. It is rarely associated with pain, only when there is a blood clot within the hemorrhoids. If somebody is pregnant, they are at risk of hemorrhoids. People who strain a lot, such as patients with constipation, patients who have chronic cough, who strain at passing urine with prosthetic problems, and people who stand for long hours with bad bowel habits can have hemorrhoids. Hemorrhoids can be categorized into different grades depending upon the severity. They can be present within the anal canal and can also project to the outside. They are categorized from grade 1 to grade 4. Depending upon the symptomatology and the extent of problem patients are faced with, various treatments are offered. If somebody is above the age of 40 years, we ought to make sure that we are not missing out something else that can be bleeding and confuse it with hemorrhoids. It is therefore important that they see a clinician if somebody has got bleeding through the back passage, and also confirm that they haven't got a problem higher up. The bleeding should not be coming from a polyp or a growth or a cancer, especially in a patient who's above the age of 40 years. Once the problem is confirmed that it is coming from the hemorrhoids, various treatment options are offered as I suggested. It could be as simple as increasing fiber in the diet, having more fluids, and regulating your bowels, to undertaking minimally invasive and open operations such as hemorrhoidectomy. It could be closed or open, it's just a technical variation in the types of operations we do. The treatment is warranted only if it impacts significantly on one's quality of life.